Just to introduce ourselves, my name is Tim, and this is my colleague Perlin. We are both from the Viria Community Services psychology team. Today we will be talking about post-traumatic stress disorder, PTSD for short. That could be the name that maybe most of us are familiar with. Yeah, so we'll be thinking about understanding trauma, distress, and PTSD. Okay. This talk is supported by Temasek Foundation as part of their Stay Prepared initiative. Stay Prepared helps to prepare the Singapore community for emergencies like major accidents, natural disasters, pandemics, severe haze, or terrorist attacks. It is supported by the Temasek Emergency Preparedness Fund, managed by Temasek Foundation. Okay, so we've introduced who we are very briefly. Just to say, the aim of these talks is to increase our mental health knowledge and to equip us with skills and techniques to manage our mental health difficulties better. Okay, in terms of the format, so the first half will be a talk. We'll be going through some information on PTSD and ways to manage it. And then this will be followed up by a Q&A session where all of you can ask your questions, in the chat box. Before we continue, just some ground rules. The session will be recorded for training purposes. So I think in a while, there might be a consent box that comes up. Just click continue if you're okay. Just to let you know, also, we'll be muting all participants during the talk, but feel free to type in your questions in the chat function. And just also to let you know that there is a moderator who will be monitoring the chat, and please just ensure that you type comments that are appropriate. If not, the moderator might have to remove you. Okay? Thanks very much. Okay, so this slide is basically to set a bit of the context for us. I don't know whether some of you, before you signed up for this talk, you were wondering, what does PTSD have to do with COVID-19, right? What does PTSD have to do with the pandemic? So what this slide shows shows a study that was conducted after the SARS pandemic. Okay, so this is a study that examined healthcare workers and people who were self-quarantined. Now, I just want you to focus on the red line. Okay. What you notice is that there's a first peak, right? The first peak, people with, if you can see the box that points to the first peak, these are people with anxiety symptoms, panic attacks, OCD. I think these are symptoms that we would associate with a pandemic, like right now, right? I think quite a few of us maybe know friends or us personally might have had some panic attacks, and maybe OCD symptoms are increasing. So that's all possible. So that's the first wave, if you like. But what's interesting, I think, is have a look at the second wave. So if you look at the second peak, right, and if you look at the green circle, you will see that actually PTSD symptoms are at a high during the second peak, the second wave of mental health difficulties. Yeah. So I guess what this slide shows is that actually PTSD is very, very relevant to a pandemic like the one that we are in currently. Maybe just to give three other interesting findings from this study. You can see that in the three pictures that you see under the box on the right. So the first one, you see a dollar sign. So that is talking about income. So what this study found was that in general, the lower the household income, the higher the symptoms of PTSD. Okay. The second one is about time. So what the study found was that the greater amount of time spent by an individual in quarantine, again, the higher the symptoms of PTSD. Okay, I don't know whether that surprises some of you or not, but I thought that was quite an interesting finding. And the final one is about mask wearing, believe it or not. So what this study found was that those who wore masks all the time, that means even during times that they didn't need to wear a mask, they actually exhibited increased PTSD symptoms compared to people who wore a mask only when they needed to. Yeah. So I guess if we put all these three findings together, I think one of the key takeaways for us is that it is having PTSD symptoms or more severe PTSD symptoms is quite highly related to having a higher perceived threat. Okay, so I think a very nice example for this would be the mask wearing, right? I guess if you are someone who wears mask when you need to and also when you don't need to, chances are for people like that, I suppose there's a greater sense of perceived threat, right? And I guess what this study found is that when there is a greater sense of perceived threat, then actually that is correlated with increased PTSD symptoms. Yeah, so I hope that this slide is helpful as a kind of introduction for us to the topic. Okay, so what will we be talking about today? We'll be talking firstly about what is trauma, distress, and PTSD. Secondly, we'll be talking about what keeps PTSD going. In other words, why does it not go away? Yeah, and the third one is strategies to overcome PTSD. So I'm sure that's something that we're all quite keen to hear about. Yeah, and just to say before we start, when we're talking about PTSD and trauma in this particular talk, we are talking only about single episode traumatic events, okay, rather than multiple repeated episodes of traumatic events. Okay. Now, just to get us all warmed up, we thought we would have a true or false quiz for all those of us who are here. I think you might see it pop up on your screen already. Hit true or false, depending on which you think the answer is. Okay, thank you to all those who have voted. Okay, so let me see if I can share this. So not sure if you're able to see it on your screen, but basically 100% of those of you who responded chose false. And that is absolutely correct. Okay, so what we're going to see for the rest of the talk is we're going to see different scenarios, and PTSD certainly does not only apply to the war scenario, but PTSD can apply to many other situations as well. Okay, so thank you so much. Shall we go on to the second question? Okay, second question, hit true or false. Thank you to those of you who have voted. I'm going to end it now, and I'm going to share the results. So this one has got a bit more of a split, I suppose. 30% said true and 70% said false. Would it be okay if I leave it there and let's go through the rest of the session and see whether we can get a greater clarity on whether trauma necessarily equals to PTSD or not? Yeah, keep this question in mind as we go on through the session. And if your question is still not answered, you're still not sure, by all means, please type it into the chat box and we will answer it at the end. Okay, thanks everyone for your active participation. Okay, so what is trauma, distress, and PTSD? So here's how we're going to define it. A traumatic event is an event that one experiences or witnesses that is, number one, unexpected. Number two, that threatens life in some way. So this could be, like death, but it could also be bodily harm or some form of an injury to yourself. And three, that causes distress. This distress could be physical, psychological, or emotional. Okay, so this would be the definition that we're working with. Okay, so this is, I suppose, the sequence, if you like. Okay, something traumatic happens. Okay, this is followed by distress. Okay, and what happens next is that there's a perceived sense of threat. So the threat is perceived as life-threatening or is going to harm you in some way. Okay, and what we know is that this leads to then trauma symptoms. Okay, but some of you may wonder, how is it that maybe some people can experience a traumatic event and not develop PTSD or not develop trauma symptoms, while some people do develop trauma symptoms? So what differentiates one group from another? Okay, and I think the animation is going to come up here. Basically what it is the difference is whether someone perceives it as life-threatening or not. Okay, so if someone does perceive it as life-threatening, that tends to lead to trauma symptoms. But if someone does not perceive it as life-threatening, then chances are that may not lead to trauma symptoms. So that's what we know from research. Okay, so that's the key. Okay, so So I think quite related to what we spoke about in the previous slide. This slide was a piece of research done on people who have experienced traumatic events. Okay, and basically what they did was that they studied these individuals over a few weeks. So you can see the graph up to about 50 plus weeks. Okay, so on the x-axis, which is the horizontal axis, you can on the x-axis you can see that that is about time since the traumatic event. Okay. And the y-axis, which is the vertical axis, shows the PTSD threshold, basically how many % of people met the criteria for post-traumatic stress disorder. Okay, so just some observations for now. I don't know what you think of the graph, whether there's any bit of the graph that surprises you. Maybe the first thing that we notice is that about 60% of people met PTSD criteria right at the start. So you can see at 0 weeks, if you look vertically up the axis, you can see 60, right? So that's 60%. That means 6 out of 10 people who experience a traumatic event met criteria for PTSD. So I don't know whether you think that's a high percentage, low percentage, or whether that's what you expected, but that's what this piece of research found. Now, also quite interestingly, if you look at the 4 to 6 week mark, so if you look at in between 0 and 10 weeks, if you look right in between, you can see that the PTSD symptoms significantly are reduced, right? It goes from about 60% to about maybe 20%. Yeah, so there's a sharp drop actually, even within such a short period of time, about a month or so, 4 to 6 weeks. Okay, so what can we learn from this graph, right? I suppose we can take away 3 points. Okay, the first point is that, as shown by the 60%, it's actually quite normal to experience traumatic symptoms following a trauma. Yeah, because about 60%, as you can see, do. So it's quite a normal experience. The second learning point is, if you have a look at, I suppose, the blue arrow, maybe the blue arrow will help. There's some kind of a natural recovery that seems to take place between 0 weeks and about 4 to 6 weeks, right? So what that shows is that actually, if we give ourselves some time to process what just happened, to regulate our emotions, to self-soothe ourselves, actually, there's quite a significant proportion of us who may not meet the criteria for PTSD after about 4 to 6 weeks. Okay, so there's a kind of natural recovery process. That's the second learning point. The third learning point, as can be seen by the green circle, where it kind of plateaus at the bottom, you can see that actually, while there is natural recovery for some, there will still be a proportion of people who might require additional support. Yeah, as can be seen by the plateau at the bottom, you can see that about 10% to 20% still do require additional support. Okay, so I hope that this slide is helpful, just to get kind of an overview of what happens to people in general across the population when they experience a traumatic event. Okay, so I guess then the very natural question that maybe all of us are asking at this point in time is, when is it PTSD, right? When is it just, I suppose, if you like, a less severe trauma symptoms, or when is it PTSD? When is it a disorder? So there are 4 key features to look out for, okay? The first key feature is re-experiencing. What does re-experiencing mean? It means you get this very vivid sense that you are back in that particular time where the traumatic event occurred. Okay, so for example, you can see on the top right hand corner, you can see a car accident, traffic accident. So re-experiencing that would look like, maybe, for example, the next time, let's say you do meet in a traffic accident, the very next time you step foot in a car again, you suddenly get this sense almost like you were back in that situation when the traumatic event happened. Okay, so this can take the form of like intrusive thoughts, or it can take the form of like flashback moments, okay, where you're kind of back in that same zone again. So that's an example of what re-experiencing may feel like. Okay, so that's the first key feature. The second key feature is avoidance. So using the example of traffic accident, what avoidance might look like is, you might tell yourself, I'm never going to step foot in a car again. I'm never going to get into a taxi. I'm actually never going to go onto the road again. Yeah, that's quite severe avoidance. So if you notice that that is what's happening, then there might be a chance that you actually do have PTSD. So that's the second feature. The third feature is increased arousal. So this is like, when you're thinking of that traumatic event, or when you step foot in the car again, you get this very sense of increased sweating. Your heart rate starts increasing. You find it difficult to breathe. All these are signs of increased arousal. Yeah. And so if you do experience that and the symptoms are quite bad, then perhaps that might be a sign that you do have PTSD as well. Okay. And the final feature is negative alterations in cognition and mood. So what that means is that your mood tends to be a bit more up and down. You feel quite down for quite a long period of time. And your cognition changes as well. So these are your thoughts. So for example, maybe you develop thoughts like the world is uncontrollable, or the world is a dangerous place, the world is going out of control. And you can develop thoughts about the world, but you can also develop negative thoughts about yourself. Things like I am a bad person or I am a terrible person. That can happen sometimes as well. So if you do notice yourself having changes in mood and you start developing these thoughts, then perhaps that might be a sign that you do have PTSD. Yeah, just to say, you can see the line at the bottom, symptoms last for more than 1 month. Remember the graph that we talked about earlier? So just to say, if these symptoms do persist for more than 1 month after the traumatic event, then again, that's a kind of sign where you might think to yourself, maybe I do have PTSD. Maybe this is something that I should go and check out. Okay? So that's for PTSD. Now, this next slide covers different diagnoses that some of you may have heard about, but that are some that might sound similar to post-traumatic stress disorder, but they are different. Okay, so that's why we've named this slide Differential Diagnosis. So if you look at the first one, if you look at so if you have a look at this slide, right, basically something happens, which is the traumatic event. Yeah. Then the RAIN symptoms. So the RAIN symptoms are actually the re-experiencing, the avoidance that we covered in the previous slide, right? So those are the RAIN symptoms. Sorry, I didn't mention that. So between immediately after the event to say several days after, yeah, if the RAIN symptoms dissipate by then perhaps what you had was probably an acute stress disorder. Okay. However, if they do continue for more than 1 month, as we've said, then perhaps you're looking at more than an acute stress disorder. You're looking at post-traumatic stress disorder. Okay. So that's one differentiating factor between acute stress disorder and post-traumatic stress disorder. Okay. And then there might be this other term that some of us may have heard about, which is an adjustment disorder. Okay, so this is where you have a significant negative life event. So we've given some examples there. So it could be maybe divorce, maybe there has been a death in the family, you have been diagnosed with a particular medical condition. So all these are negative life events, or you lose a job. Okay, these are negative life events. And so what we do know is that sometimes with these negative life events, it might lead to quite distressing symptoms. But the key difference here is that actually once the negative life event is solved, I suppose, or once it dissipates, it goes away. So maybe, for example, if you lose a job, you have these distressing symptoms, right? Cannot sleep, for example. But when you get a job back, and you have kind of in that sense recovered, you notice that actually the distressing symptoms go away quite quickly. Yeah. So if that is the case, then we would probably say it's not so much a traumatic event, but more perhaps of a flavor of a negative life event, then perhaps we would term that more adjustment disorder than we would post-traumatic stress disorder. Okay. Okay. So another quiz before we go on to the next segment. So I think it's coming out on your screen. The first question, what do you guys think? PTSD is not treatable. Wow. So many responses already. Keep them coming. You can see that 93% said false. Okay, and a few of you said true. So we're going to learn from the next segment that Pauline will be taking us through that PTSD is treatable. That's the good news. And I'm sure everyone is looking forward to see how we can treat PTSD, right? So that's what we're going to see in the next segment. We're going to have another quiz question before we move on. Okay. Next question. I should not talk about my trauma with anyone. What does everyone think? Okay, and I'll share the results so that everyone can see. So 96% of you said false. So most of us think that it is a good idea to talk with someone about our trauma. Yeah, and that's again what we're going to see in the next segment. So stay tuned. I'm now gonna hand us over to Pearline, who will be taking us through the next segment.
Great, thanks team. So before we go into, talking about what can we do to kind of overcome PTSD or how can we talk to people about it, maybe let's kind of look at what actually keeps PTSD going, or what causes some of us to experience PTSD and some of us not to experience PTSD, like what team shared, right? And I think it's really around the beliefs that we kind of developed from a traumatic event. So kind of looking at the model now, let's kind of find out a bit more, right? So like what Tim shared, when something happens, right, we may or may not, develop certain beliefs about, ourselves, or the event, the world, or the future. But naturally, sometimes we end up developing those beliefs, right? So we may start thinking that, the event that happened was really scary, or I was actually going to die, or the world is a dangerous place. And when that occurs, then naturally, it causes us to feel that we were exposed to danger, and that we might be exposed to more danger in the future. So we might start thinking that, danger is always around the corner. So this causes us to then constantly look out for danger, or constantly feel that, that danger is still present, right? Wherever we go or wherever we do, which further then reinforces our belief that the world is indeed a dangerous place, right? So I have to kind of look out for danger to kind of protect myself, right? And as we constantly look out for danger and kind of still experience danger, just lurking around the corner, what it does is that it causes us to remember about, the traumatic memories that we actually been through, right? And the thing about, the event being so traumatizing is that it actually causes us to sometimes experience the memory as though it's happening again, right? So that's part of the RAIN symptom, R for re-experiencing. So we may experience the memories or the event as though it's happening again, which then gives, the element of nowness to the quality of the memory of the trauma, right? So we may kind of sometimes we may have flashbacks, which some people kind of who experience flashback actually describe it as though, they are kind of going through the whole thing, the event all over again. Or some people experience, the memories of the trauma as though it's like a projector playing that event on the screen, like in the cinema. So you're just like kind of watching it, but you can't kind of disengage from it. And again, it has that nowness flavor, right? So maybe sometimes when you are watching a movie that you're so engrossed, you actually feel like it's happening in that moment. And some people with experiencing of those memories actually describe it as that. So what does that nowness of the memory actually does to our, our beliefs about the event, the world, the future? Again, it reinforces that the world is dangerous, right? Or that you are in danger. And then very naturally, when we have all those beliefs, then we naturally adopt some coping strategies, right? Like avoiding the trigger, avoiding going out, constantly checking for danger, right? And these are really natural reactions to a very traumatic or distressing event. But what this does again is that it further reinforces our belief that the world is dangerous, or I'm going to be in danger, I'm going to be hurt again, and then that just maintains the cycle. So we just find that we end up almost getting stuck in this cycle of trauma, and find it difficult to break away from it, right? So on the topic of COVID-19 and how it impacts our trauma, I think Tim very well earlier mentioned how we can develop PTSD from a pandemic. So now let's look at Mr. Tan as almost like a case study, right? And see how his symptoms of trauma actually really quite naturally develop and must maintain. So for instance, Mr. Tan was quarantined due to COVID-19, right? And that was quite a distressing period for him because maybe he perceived it as, as threatened death for himself. So then as a result, he developed certain beliefs about the event, himself, the world, and the future, even after coming out from the quarantine. So perhaps even after finishing his quarantine period, Mr. Tan might walk away thinking, oh no, COVID-19 is really dangerous and the world is really a dangerous place to be in. And if this didn't end, I might actually be stuck forever, right? So then he may right? He may develop all these beliefs about the event and the situation that he was in, right? And then very quite naturally, what happens is that he might start thinking that, oh, there's danger everywhere, right? Because the pandemic is still here, or even if the pandemic is solved, there might be is cured, there might be something else that might harm me because the world is dangerous, right? Because that's his belief. So when he thinks that there's danger everywhere, then quite naturally, it reinforces his belief that this place is the world is gonna be dangerous and he's maybe gonna die from it, right? And what that causes him to do is that it might kind of trigger certain memories of the trauma, of being stuck in quarantine, which further reinforces that belief of his. And then naturally, because it's so distressing, it causes him to develop certain strategies, right? So what type of strategies? Perhaps quite naturally, he would then avoid going out because he feels that the world's in danger, right? Or he's in danger. Or he might even avoid talking about it because it's so distressing. Right? So he might do certain things that maybe in the short term causes him to feel relieved, but in the long run actually just reinforces the belief that the world is dangerous. Yeah. So we can see, in this example of Mr. Tan, how the PTSD symptoms or the range symptoms can actually quite naturally, continue and persist, right, with what he's doing. So what can we do about it, right? How can we overcome PTSD? So if we kind of look at the model again, right, I think the first thing that often we try to do to kind of overcome PTSD or break the cycle is really focusing on these two elements, the sense of threat, which is the dominant, always present sense of threat, and the nullness to the memories, right? So sometimes when we experience the memories of the trauma, it can actually cause us to feel that the trauma is happening in the here and now, right? Which is really the sense of nullness rather than something that has happened in the past. Yeah, so this actually has to do with how our brain store the memory and how it's unable to fully process the memory because it was just quite distressing for your brain to kind of even think about it. So when this happens, what we really want to do is kind of gently guide our brain or ourselves back into the present moment and reminding ourselves quite gently that we're no longer in the past. And one really effective technique that therapists or even professionals or even people with PTSD try to do is called grounding. And that's one way that we can use to overcome the sense of numbness, right? So there's really a lot of different types of grounding techniques and it really depends on which works for you, right? So some of it may work for some people, but some of them may not work for other people. So it's really about exploring what works for you. So just to give you a different sense of what different grounding techniques may be. The first one is kind of, how we mentioned that the re-experiencing of memories can cause us to actually think that we are back in the past. So sometimes kind of just reminding ourselves of today's date and time, today is 21st of July, it's a Tuesday evening, and I'm no longer back in March where I was in quarantine, may actually cause us to kind of feel a bit safer, a little bit better. Right? The other thing, the other grounding technique that we may use is kind of using all our five senses, right? So it helps jolt us back into reality, into the present day and time. So some of us may kind of use maybe the smell of peppermint or maybe even durian to kind of jolt us back into the present moment so that it takes us back, it takes us away from the nullness of the memory, but that kind of bring us back into the current moment, right? The next thing that sometimes we use is really kind of using the sense of touch, right? So touching ourselves, because that kind of serve as a reminder and brings us back to the present moment as well. This is particularly powerful for maybe certain events where you actually worry or you actually thought that you may lose certain body parts. For example, in a car accident, if you thought that maybe you might have lost your legs, right? But when it didn't happen, that's when you have the flashback, you may still think that maybe you had the fear of losing your legs, right? And that's quite common with people with road traffic accident when they feel that maybe they might have lost some legs or some limbs or some body part. So sometimes when they re-experience the memory, they actually go back into that moment where they felt that perhaps they worry about losing some body part, right? So what we might get them to do is really just reminding themselves by touching themselves, by touching their leg, for example, or even maybe standing up to update their memory or to update their brain to know that actually they didn't lose that body part. Right. And finally, using statements like "I'm okay now," "I've overcome the trauma," or I'm no longer in the past, can be quite powerful ways to kind of remind ourselves that we are no longer stuck in the past, but we have kind of lived through that, and we are here right now at this present moment. Right. So we can use or explore various grounding techniques to kind of help us update our memory, so that it's no longer in the past, and no longer have that sense of numbness to it. Right. The next thing that we can do is really kind of focusing on the perceived beliefs about the event, the worries, the world, and your future. Right. So as what Tim mentioned, the key difference between why two people who experience the same traumatic event may come out differently or may experience it differently after the event is really because of our perceived beliefs of how we make sense of the event, right? And sometimes when we kind of think that the world is dangerous, then we may naturally kind of have more, RAIN symptoms or trauma symptoms. So what we really want to do is kind of revisit the trauma and almost update our brain, right? And we really want to kind of talk about it, make sense of it, and in that process, look at the developed perceived beliefs and see how we can almost update them to what we know now, right? So it's almost like updating our memory. And I think some people in our course of work actually think that, maybe it's not so good to kind of talk about the trauma. And I think earlier when we did the quiz, I think one or two of us also felt that maybe, it's maybe not helpful, or maybe might be quite scary to talk about the trauma, right? Maybe we can give you an analogy of why we believe kind of talking about the trauma helps, right? So just imagine that, the traumatic memories are like items in a messy cupboard, right? So imagine that you have a lot of these items, right? And then because it gets a bit distressing for you, I think sometimes a typical response is to kind of really kind of try to stuff the items back into the cupboard and then close the door as quickly as possible, so we don't have to deal with that, right? Because that might be quite easy, and just ignoring it and avoiding it, right? But what happens if we continuously shove it back in, without kind of maybe putting it in place? What happens the next time where we open the door again? I don't know whether, what some of you have any thoughts. Do you want to kind of type in the chat box? What do you think would happen to all these items if we kind of shove them into the messy cupboard and then just close the door really quickly and not deal with them? And then the next time we walk past the door and we kind of touch it or open it. Do you kind of want to make a guess of what might happen? Right? Yeah, it will explode, right? Thanks, Simon. So it might explode, right? The next time you open it, all the things might drop out or it might pop out, right? Sometimes even with the slightest touch of the door, it might kind of explode and kind of come all out, right? And that's the case with a traumatic memory. The more we kind of push it away, the more we kind of try to avoid it or push it back into our head. The slightest reminder or the slightest trigger may actually cause it to kind of pop up, right? And sometimes the triggers or reminders may not seem very obvious, right? So we can't really go around avoiding all the things that remind us of it, because we actually may not really know what are the triggers. So that's why I think some people experience the flashbacks or the re-experiencing quite randomly, because all these things just kind of fall out, right? The memories just kind of fall out and pop out, right? So actually, when we say we want to talk about the trauma, what we really want to do is like I guess some of you may then think about what's the best way to kind of deal with the items in the cupboard. Perhaps some of you might say, oh, let's kind of arrange them neatly and kind of pack it, right, so that it doesn't pop up. And that's exactly what we want to do when we talk about the trauma, right? What we want to do is really, we want to take the items slowly out of the cupboard. We want to examine them carefully, whether, we want to keep them, whether, this is good, this is maybe not so good at this point. And then really examine it, and then we want to kind of fold them neatly and kind of put it back in the right place, right? So we really want to kind of make sense of the items in the cupboard, right, and kind of put it back quite neatly. And really the goal of talking about your trauma here is not about throwing those items away, or kind of discarding them. but really it's about making sense of these items or making sense of your memory so that it doesn't pop up as and when, but knowing that, we can put them in a nice place or put them in the right place so that we can access them as and when we want it, and we can get control over them, but not allowing them to kind of pop up or explode like what Simon said, randomly, right? And of course, admittedly, this can be quite difficult to do on your own. Therefore, it's perfectly okay to seek professional support to do so, to really examine the traumatic memory, to make sense of it, to process it, and then to kind of, update our brain in that process and then put the memory neatly at the back of our brain, or put it somewhere in our brain, really store it quite neatly, right? And that's what treatment of trauma really looks like, right? So that's a big chunk of it, right? And lastly, with regards to coping strategies, I guess like what some of you or what some of us may experience, sometimes the trauma actually causes us to avoid things that reminds us of the trauma, or it may cause us to maybe stop doing certain things because we feel very sad and we feel hopeless, so we stop engaging in activities that we used to enjoy. So really the start of overcoming trauma is really kind of thinking about what is it that the traumatic event has caused you to withdraw from doing, like some activities? Has it caused you to kind of stop doing? And what has it caused you to avoid? And really taking that step of difference in your life so that you don't feel stuck anymore. So sometimes it's helpful to identify the areas of your life that may have changed as a result of the trauma. For example, you may have stopped kind of maybe going to work, or you may have stopped exercising, or your relationship with your friends or family may have been impaired because you don't want to talk about it, or you avoid doing certain things. And really it's important to kind of maybe slowly start restarting some of these activities as soon as possible. And just a note here, when we talk about slowly reclaiming your life, right, so that trauma doesn't have a strong hold over it anymore, it doesn't have to be a big thing. It doesn't have to be like, now I want to go to uni, then you kind of sign up for uni. Or it doesn't have to be something big. Actually, it can be as small as maybe making a cup of tea, because maybe for Mr. Tan, he used to like drinking tea, but ever since the quarantine, because he was drinking a lot of tea, maybe that caused him to kind of remember the traumatic memory. So after coming out for quarantine, he stopped making a cup of tea anymore, right? So if that's the case, then we really encourage Mr. Tan to maybe slowly start making that cup of tea again. So really, it doesn't have to be a big thing, but really just making that small step of difference, right? That you have stopped doing that maybe made you happy or gave you pleasure, right? And again, like I mentioned earlier, sometimes the traumatic event may cause us to withdraw from our family or for our loved ones as well, right? Maybe because we are fearful that, maybe our trauma or our distress can actually cause them worry. But what research has consistently and repeatedly shown is that social support and relationships have been the strongest protective factor in buffering the effects of trauma, right? And it's one of the strongest predictors of success for overcoming PTSD. What this really means is that, when they looked at people who experienced trauma, those who actually said that they have really strong social support or family support or even like support from others, actually shown better recovery, faster recovery, and lesser trauma symptoms, right? So although some of you may not think that it's really a treatment, but actually that is really the strongest predictor of success of overcoming PTSD. So we think along the lines of, reclaiming your life and making that step of difference. Just maybe thinking to yourself, is there anything that you can do to make that step of difference to reclaim your relationship with your loved ones again, if your relationship with your loved ones has been affected because of the trauma, right? So with that, we just want to kind of leave a final technique or tip or reminder in overcoming trauma, and that's called that's called stop, right? So what stop really means is that, the first thing when you kind of feel distressed or remember about the trauma, really just stop and pause for a moment, right? And then take a deep breath, and then maybe practice your grounding techniques if that helps. And then observe what's happening, observe what's happening around you, observe what's your thoughts or your perceived belief about the trauma, and then pull back and put things in perspective, right? So if your belief about trauma is that the world is dangerous and there's danger lurking everywhere around you, then maybe we can put things in perspective by thinking that, hey, actually maybe that's not true. Maybe there is danger, but what is the chances of this happening, right? Again, right? And finally, practicing what works, right? So if kind of reclaiming your life works, making a cup of tea works, or if talking to a friend or family works, then do that and proceed on with your life, right, on whatever you're doing. Right, so hopefully with that, it gives you a little bit of tips and techniques to slowly start overcoming PTSD. And I think certainly like what Tim had shared earlier, PTSD is indeed treatable, and like what many of you kind of shared in your responses as well, PTSD is certainly treatable. So in terms of treatment, there are actually both psychological and medication to treating PTSD. And we must kind of disclaim that we're psychologists, so we're not really psychiatrists, and we don't really administer medication, but really just looking at evidence out there for the treatment of PTSD. Both are equally effective for the treatment of PTSD. Maybe some of you may be wondering, why are we giving them antidepressants? Again, we are not psychiatrists, but the research has shown that PTSD is actually associated with low mood or symptoms of depression because of the avoidance, right? Because when we avoid doing things, when we stop doing activities, or when we develop certain beliefs about the world or ourselves, we may develop some critical thoughts about ourselves or negative thoughts about the world, which may cause us to feel low in mood or depressed. Hence, the antidepressants really meant to kind of focus on that bit of symptoms. Again, there is not enough information to tell us whether one of these is better than the other. However, guidelines from other countries, such as like the NICE guidelines or WHO guidelines, actually suggest that trauma-focused CBT or EMDR should actually be offered as the first line of treatment, really because for PTSD, unlike other type of mental health conditions, we are really focusing on talking about the therapy, the memory and making sense of it, rather than treating the range symptoms per se, right? Hence, when it comes to treatment and evidence-based treatment, it's really about talking therapy and kind of making sense of the memories and processing the memories. Yeah. If you have any questions about treatment, feel free to kind of type in the chat or chat box, or even kind of have a chat with us. After that, you can contact us. But with that, we want to kind of provide you with some helplines. So if you feel that you need immediate support, then you could call the National Care Hotline, which is 24 hours hotline, or you can give us a call at the Career Counseling Hotline, or even the SOS hotline if you have thoughts about hurting yourself and thoughts about suicide. And if you feel like you're in immediate harm, do contact your emergency medical services at 995 or approach your nearest A&E department of the nearest hospital. So with that, we come to the end of our sharing. And, we would like to kind of go into questions now, the Q&A segment now. And, thanks for keeping it really interactive and having, wow, that's a lot of questions.
Wow,
thanks for all the thanks for all these questions. So without further ado, shall we kind of go straight into the questions? Okay, so the first one. How is complex PTSD different from PTSD, especially in terms of treatment? Right. I guess with complex PTSD, with multiple trauma and really experiencing PTSD from a young age, the treatment may not be largely different at the start. So even with complex trauma, when there's multiple traumatic incident, what we usually do in TFCBT is really kind of looking at one traumatic event first, right, and then moving on to the next traumatic event. So it is still largely quite similar in terms of evidence-based treatment. Yeah. Next question regarding diagram, does that mean coping strategies are not effective as they also reinforce our perceived negative beliefs? Yeah.
That's a really good observation. Yeah.
Yeah. I guess with coping strategies, it really depends. So it's not a blanket no. I think when we talk about coping strategies, there are adaptive coping strategies and maladaptive coping strategies, right? So the maladaptive coping strategies are things that, exactly like what this participant has mentioned, are things that reinforce our perceived negative beliefs and take us away from our goal of getting better. For example, avoidance, not talking about it. Whereas the adaptive coping strategies could be, for example, your grounding techniques, right? The deep breathing, etc. So it's not that all coping strategies are not effective, but really some. And maybe it might be quite helpful to then think about it in the sense of the diagram, right? Like when you do this, how does it, interact with the other, parts of the model, so that you can kind of see whether it breaks the cycle or it reinforces it. Yeah, Tim, not sure if you want to add anything else?
Yeah, no, nothing. I think it was just a very, very, very good observation that,
Yes.
sometimes there are certain coping strategies that we use that actually have a counterproductive effect. Yeah, in the case of like avoidance, it helps us to calm us down in the immediate term, but then as this person has very rightfully, very helpfully pointed out, that can actually reinforce beliefs like, the world is really, really dangerous if I actually go out there.
Yeah.
That can keep the cycle going. So yeah, really, really good observation.
Yeah. Great.
Next one, maybe I can have a stab at the next one.
Yeah, go on.
Could PTSD develop into OCD? How would the therapist give treatment for this case? Wow. Yeah, it's complex. Certainly, you can have more than one mental health disorders at one time. I don't know, Pauline, what you think? I think that is possible, certainly. I think it is possible for PTSD to then subsequently develop into OCD. In terms of treatment, I guess it will be a collaboration between therapist and the client. My current sense is that perhaps we would probably treat the one that is more pressing first, and maybe the one that comes before. So the primary diagnosis first before we go on to what comes after. So that probably might be the case, or maybe the one that has more distressing symptoms in the now. Yeah, first. What do you think, Pauline?
Yeah, I think that's a really good response. I can see how that can happen, right? If you're constantly checking for danger, and then but I guess the maybe the difference is also the obsession and the compulsion, right? Because like I think our previous week, 2 weeks ago, like, oh, was it previous week? Anyway, the talk on OCD, we actually said that OCD actually has two portions. One is the obsessional thoughts, and one is the compulsive behavior, right? And that if you don't check, then you believe that something's going to happen, right? So it can certainly happen, but again, it's also kind of looking more specifically into that behavior and why are we checking and why are we doing certain things, right? Because chances are, if perhaps in PTSD, if you're checking constantly for danger, maybe that's really a protective way of kind of coping. But maybe if you stop checking, you may not think that actually something bad's really, really going to happen, right? I think that's maybe like the key difference. But I think that, like as this person said, it can develop. Yeah. Right. Okay. The next question: if cognitive therapy and coping strategies fail, leaving only memory part, what treatment will be effective? I guess when it comes to kind of treatment for PTSD, I think the key, like what this person mentioned, is really the memory part, right? It's really making sense of the memory and kind of reliving the memory and kind of almost rescripting the memory or the traumatic event that has happened. So sometimes just kind of doing kind of looking at the narrative of how you make sense of the memory and kind of revisiting that may be quite helpful in certain experience of trauma. So actually that there are other types of therapy like narrative exposure therapy, or even EMDR that doesn't really kind of use really cognitive therapy. Has actually shown to be effective. Okay, how does having a pet help cope with PTSD and CPTSD?
This is a really good one. I think the grounding slide comes to mind for this
Yeah.
question. Pauline, what do you think?
Yeah, absolutely. I think you're right.
Yeah, having a pet with you can help you to ground the experience, right? To tell you that everything is okay and that you're no longer in the event, in the initial traumatic event.
Yeah,
Yeah.
definitely. And I think sometimes maybe for some people, having a pet makes them feel safe.
Yeah.
Isn't it? Right? So it's kind of just reminding them that actually you're safe, right?
Yeah.
You're no longer back in the past.
Yeah.
And that can certainly help with the
Yeah.
brain symptoms of PTSD.
Yeah. Definitely. Next one. What theoretical modalities will be useful to treat clients with suspected PTSD? So I would say in general, the model that we've talked about today is CBT. Some of you would have probably heard about it, cognitive behavioral therapy. In general, what CBT looks at is how our thoughts are connected with our behaviors and how they're connected with our emotions. So thoughts, behaviors, and emotions. So I would say in general, the theoretical modality would be CBT. I'm only hesitating slightly because of the suspected PTSD bit. I think as we shared earlier in the slide on the differential diagnosis, I guess suspected PTSD probably does not mean confirmed PTSD. So I think we do need to think about whether, could it be an acute stress disorder? Could it be an adjustment disorder? Could it be, any other disorder which looks like PTSD but maybe is not? So I think it would be helpful to ascertain that first. But I would say, notwithstanding that, in general, I think the cognitive behavioral therapy model is certainly one that has got quite a bit of evidence.
Definitely. I think you're right, Tim. I think it's good to ascertain whether it's PTSD or not before kind of going straight into treatment. And if any of you out there suspect that you have PTSD, it's always good to kind of maybe give us a call. You can speak to one of us, a psychologist, to kind of maybe help you ascertain that as well. All right. Next, for revisiting memories, does it apply for adjustment disorders?
This is an interesting question. I guess it's making me think of the cupboard, the clothes cupboard picture that you showed. I'm not sure whether in the case of adjustment disorder, whether the same analogy necessarily applies. That's what's making me hesitate slightly. I think as per usual, I guess for most things, it is helpful in terms of revisiting the memory. It is helpful to talk through that experience with someone. So maybe in the case of adjustment disorder, I guess I'm thinking maybe an example like, a loss of a loved one. Let's say a loved one dies. I think it is helpful to talk through the memory, talk through the, like how things unfolded and your experiences, but perhaps not in the same way that you would a traumatic event. Yeah.
Yeah, I think you're absolutely right. I think kind of going back to your slide about the difference between adjustment disorder and ASD and PTSD. I think the key difference is that whether or not the stressor disappears or not, right? Like ASD and for PTSD, you would still kind of almost have those symptoms. Whereas for adjustment disorder, once the stressor disappears, you kind of almost sort of recover. You get better. So it kind of just tells us that maybe the traumatic memory may not play such a key role in maintaining the symptoms, but rather the stressor itself. So kind of, I agree that maybe kind of talking about it can be helpful, but maybe it may not play such an integral role in treatment and in recovery from it. Right.
Okay,
next.
Question 8. Why do people keep reenacting their traumas? What can be done about it? This is a good question.
So I'm not quite sure what it means by reenacting their trauma. But I guess perhaps, if this is kind of talking about more like flashbacks or re-experiencing the trauma, then I think sometimes, again, sometimes it just, like going back to the cupboard analogy, like sometimes it doesn't really happen because it's within our control, but really it's because the slightest reminder of it caused the memory to pop up, right? And really it can happen quite randomly. So what can be done about it is also then kind of processing that memory, making sense of it, talking about it. Right. Okay, I hope we kind of sort of answer that question.
Yeah, I think so. Next one about, it's an interesting question about the drowning experience and about the difference between PTSD and phobia. It's making me think that I should have added phobia into that slide as well. This is a really good question.
Yeah.
This is a really good question. I think thinking about the 4 features, right? The RAIN symptoms.
Yes.
I think it'd be fair to say in the case of PTSD, you get that re-experiencing, the nowness of it, which I think differentiates it from a specific phobia in this case. Yeah, you're absolutely right that arousal happens in both the cases when you are afraid of going into the water and when you have PTSD. But I think the difference might be that the re-experiencing, I think, is the distinguishing factor between having a phobia versus having PTSD.
Yeah, absolutely spot on. Yeah, it's really the kind of relooking. I guess when it comes to, I mean, just a general kind of observation when it comes to mental condition, there can be quite a lot of overlap. But I think it's about thinking about the distinguishing factor. And I guess in terms of treatment as well, the difference between PTSD and phobia again, in terms of PTSD, the sense of the nullness to the memory and the intrusive re-experiencing part actually plays an integral role in maintaining the symptoms. Whereas, hence, in treatment for PTSD is really kind of revisiting the memory, making sense of it, processing the perceived beliefs. Whereas in phobia, because there's no kind of sort of strong perceived beliefs about like the world, the future, yourself. It's really about the fear of the specific trigger. That's really about kind of exposure to it, right?
Yeah.
Okay.
Next one, how can we show support to loved ones when they want to revisit and make sense of their traumatic memories? Yeah, this is a really good question.
Yeah.
I guess on one level, you can just be there with them to talk through it with them. I suppose that's one way. People with PTSD can sometimes often not want to share so much with people. They kind of keep some of these memories to themselves. So I think it's very helpful to be available, to be there, to show them that you care, and to ask them whether they do want to talk to you about it. And then maybe you can process it together. I kind of want to say actually a very helpful other thing that you can do for them is actually to help them or encourage them to seek additional support if they do need to. Because again, we do know that a lot of people who suffer from PTSD, because of reasons that, sometimes it can be like shame, or it can be a sense of guilt or something like that. For a variety of reasons, it can be hard to seek help. So really another very useful thing that you can do for your loved ones is actually to encourage them to seek professional help, seek help from others to try to get better.
Yeah, great. Okay, next question. Apart from social support and relationships, what other strategies can we do to manage PTSD better?
This is another very good question.
Yes. I think they're kind of going back to like the, talking of the different techniques that we spoke about. So like the grounding techniques, the revisiting the memory, maybe even breathing, mindfulness as well. Mindfulness is a big thing in PTSD treatment. And really that's because it targets the nullness. Right? Yeah. And I guess sometimes kind of the thing about PTSD is like what we mentioned in the diagram. It kind of stops us from doing certain things. It causes us to avoid doing certain things or avoid certain reminders. So sometimes maybe kind of slowly stop avoiding it or slowly facing those triggers or reminders can be quite helpful in helping us manage PTSD better. And definitely I think one thought that many of our clients have is that, it's really quite scary to face the triggers. And I think that's really normal. And that's really a natural reaction, when it comes to this, like facing distressing emotions. So that, again, it's definitely, if you find that it's quite challenging to do all those things on your own, then again, it's completely fine to kind of maybe speak to us or seek professional help for that. Yeah. Okay, next question. How does EMDR work for trauma? You want to take a stab at that question?
No, why don't you go and then
Right. So I guess EMDR is really about eye movement, right? So what they do is that for EMDR therapies, what they do is that they ask the clients to kind of bring the specific memory to mind and kind of get them to kind of do certain eye movement. Right. But I guess the key here is not so much about the eye movement in EMDR, but it's really about, again, bring the memory to mind, revisiting the memory, and research latest research have shown that actually eye movement may not be really integral, right? So the change or the change process in terms of helping someone overcome trauma is really the ability for the therapist to kind of allow the client to kind of revisit the memory in a very safe way. Yeah, and in a very supportive manner as well, and kind of helping them make sense and process the traumatic memory in their own way. Yes.
Yep. Nice one. Let's go to the last one. At which stage of PTSD is medical intervention necessary, since high percentage of people go through natural recovery? Yeah, I think that's in reference to that slide, right, where we saw the kind of sharp drop. So I would say, yeah, in general, I think it is probably, as can be seen, there's like a 4 to 6 week period where we know that some kind of a natural recovery does take place. So perhaps I think if you do have the symptoms past 1 month, past about 4 to 6 weeks, then perhaps that is time to seek professional's help, or to seek some form of intervention.
Definitely. I think that's absolutely right. I guess even if you haven't waited for 4 to 6 weeks, but again, the brain symptoms are really quite traumatizing for you, quite terrible, quite severe, then in fact, you don't have to wait the whole 4 to 6 weeks to kind of seek help. Right. So maybe within the first 4 to 6 weeks, if you do seek help, maybe the therapist or the psychologist may not really talk about the trauma per se, but they may kind of help you cope with it, or provide you with the emotional support or techniques to kind of cope with all these brain symptoms. So I guess it's really based on the individual. If you feel that after the traumatic event, you actually feel the brain symptoms are quite severe and that you can't cope on your own, then it might be a sign that you may want to seek support, professional support. But if you feel that you can kind of wait it out, you have strong social support, right? And social support is the single predictor of success, of recovery, and actually has proven to be quite effective in helping people overcome their trauma symptoms. So if you have strong social support and you feel like you can cope on your own, then I guess it's something that you can wait out for like 4 to 6 weeks before seeking professional help. Yeah. Okay, really thanks for all these questions. It really helps us, think on our feet as well. So with that, we've come to the end of our talk. But really what we want to, again, seek your help is to kind of allow us to get feedback, right? So again, the mental health website. So again, there's a lot of resources on the Temasek Foundation My Mental Health website, which you can access at the link here, stayprepared.sg/mymentalhealth. And we are on there as well. So if you click Ask the Expert, or if you have any more questions and you click Ask the Expert button, you can actually send the questions to us via email. If not, we really appreciate your feedback. Thanks for joining us tonight. Again, we really hope to hear from you so that we can continuously improve our talks. We hope that you really found this helpful as well. So you can go on to the website link, tinyurl.com/LTMHPTSD, or you can scan the QR code on the slide here. And it will take less than 1 minute, but it's really quick. So really just kind of pop in your feedback for us, and then we can really make use of it to improve. And our moderator has also shared the link on the chat box. So if you like, you can also click on the chat box. And thank you all again for joining us and the active participation.